Good evening, everybody. Thank you all so much for joining me. I'm Debbie Durako, Senior Director of StellaLife, and I have a mutual colleague with me tonight on our call to teach you more about StellaLife, Rachel, who will be monitoring the chat and providing us, if you have questions that we can help you with, we'll be happy to do that. But thank you all so much from the very bottom of my heart for joining me tonight. I've been with StellaLife almost from the beginning, and my background is dentistry like you all. So I really understand what you go through every single day and all of the challenges you face. But I can't tell you how excited I am about sharing this technology with you tonight. There's so many things in dentistry that have been incredibly innovative in the last several years that we're all utilizing in our practice. But I promise you tonight, what you will see is the innovation that we discovered in over 20 years of being able to study this product and put the things together that make it work the way it does. So thank you again for all joining me. And if you have team members who would be interested in learning more, then we can certainly, we're recording this tonight, so we can share it with you all and your team members as well. So let's go ahead and get started. My goal for all of you is to show you what is this StellaLife that everybody's talking about. I want to show you, really important to all of us here at StellaLife, the science behind the product and the studies that we've been doing for over 9-10 years now on the product and how it can really help you and your patients. And particularly all of the wide spectrum of application through procedures and incorporating it into your practice. How do you do that if you're bringing in something like this to work with your patients, and then showing you what's exciting and really new on the horizon when it comes to dental care and looking at more of the root cause. And I'm going to introduce you to some amazing things that we've been doing with probiotics, as well as a product we call Denomatica. And I'll tell you a lot more about that here in just a moment. But really important is how you can elevate the quality of your care using StellaLife. So a long time ago, over 20 years now, we were on a mission, and our mission was to improve people's lives. And one of the biggest parts of that mission was to help reduce the opioid use in the US. We wanted to find a way to take plants and minerals and create a product that not only could be superior as an antimicrobial, but also be able to manage pain in a way that we never had before. And as you can see, the patients really love this product, and our doctors do as well, by our Trustpilot reviews and just the accolades we get every day from people who are using these products within their practice, but more importantly, their patients who are reaching out to us saying how wonderful this product has been for them. That kind of led us to being able to get very involved with the universities all around the country now, over 40 different universities that we work with, along with being awarded the top wound healing award 7 years in a row with Dental Advisor. So we have been doing a lot of work and a lot of effort to help bring this product to your community and to see the differences that we're making. So we're going to start with talking a little bit about the topical approach with the products that we have using every single day in all these practices around the country. So when you look at our products, I want you to think about our rinses as an antimicrobial, bacterial, static type of product. But here's where it gets really interesting, is that it actually has this very stealthy quality about it. It targets the bad pathogens while leaving more of your commensal bacteria alone. It doesn't bother it. It stealthily finds those particular targets and takes them out for you. The other product that we have, we're going to talk a lot about tonight, is our gel. Patients love this gel. Our doctors love the gel, and here's why. It has a tremendous amount of anti-inflammatories as well as antimicrobials. It is an accelerated wound healer. And the uniqueness of all of the products I'm going to talk to you tonight about is that we don't harm fibroblasts. And that's what's making wound healing a whole different game for us today by using StellaLife. And we'll also talk about our recovery kit, which is a 3-part system. We call it the 333 program. And what you're doing with this product is you're starting at 3 days before surgery and continuing 7 to 10 days post-op. And the value of this product is that it helps your patients prepare for surgery. It allows you to have an incredible environment to work in where you've cleaned it up and you've really saturated these tissues with anti-inflammatories, allowing the patients to have less swelling. And remember those good old fibroblasts that stick around, we're moving them, and not just nice little gentle pace, but moving them very quickly. And I'll show you some really neat case studies that have been shared with us by other doctors and universities that have been studying our product now for several years. So we started out as a topical product. But over the years, we've learned that there are so many other things that are going on systemically. And we've all heard about the oral systemic link. So what we wanted to do is start thinking about root cause and some of the things that are really causing patients to have perpetual disease. They just seem to never get past or into a remission state with their disease. And bacteriologically, there are very high levels of bad pathogens versus good bacteria that fight those bad pathogens. So that's what brought us to develop an oral and gut probiotic, super unique, as everything is with StellaLife, and allowing us to provide the patients with an opportunity to rebuild the good flora in their bodies. And then we'll talk a lot more about that as well here towards the end of the program. And Dentamedica, very interesting what's happening in our implant research in our implant world. We're actually seeing implant bone integration and failure of bone integrating at the highest levels we've seen. And we're understanding better what the root cause of that is. And it's being traced back to low vitamin D levels. And it's not just a little bit, it's big discrepancies. So I'm going to talk to you tonight about that, what's on the horizon, what we could be doing differently to help support our patients in really preparing them for these surgeries, but also really giving them a good shot at being able to integrate that bone into that site. So we're going to cover a lot of material and a lot of interesting aspects of StellaLife. And again, Rachel is here to help us. And if you have any questions or anything that comes up during our program, please feel free to enter it into the chat. So one of the very first studies that came out of a university was the famous Bern University. If you're not familiar with them, they're located in Switzerland, and they are one of the world-renowned facilities for dentistry as well as medicine. And they take a look at a whole different perspective of training and understanding root cause and some of the things that we've been struggling with in dentistry. So they were curious. And one of the first studies that they did was on fibroblasts. So what you're seeing is green is alive and red is dead. And of course, in our traditional model of in the US, we were all taught to use chlorhexidine. So they said, let's take a look and compare it to see what happens to these important fibroblasts. Well, what you're seeing is a very, very quick response. StellaLife, the green, is under 10 seconds, they're still alive. But when you look at chlorhexidine, you see within that very short period of time, it literally wipes out all of the cells that are creating collagen to heal our wounds. This is not exactly what we want to have happen right after surgery. So in this study, they discovered not only can StellaLife keep the fibroblasts alive, they also described how the cells respond to it in that it actually induced cell migration and proliferation, gene expression, and really important collagen synthesis. And by the way, all these studies are in depth on our research tab on our website. So you're also welcome to go there and take a really deep dive into these studies to understand how they did them, but also how interesting some of the things they've discovered during that time when they were studying our products. So of course you can't have one study, you have to have more than that. So this came out of the University of Texas. Dr. Georgios Koutsakis, one of the leading professors in the world of periodontitis and understanding peri-implant diseases and things that are occurring at that level of the implant. So what he wanted to know is, so let's take a look again in a skin test and let's see what happens under the microscope. So what you're looking at is the control, which happens to be salt water. And you see these tiny little fibroblasts coming out and not too shabby. They're alive. And we know salt water is an antimicrobial as well. So this is good news for us that when we use salt water. Here's an example of what happened when they used chlorhexidine at the same time points. And what you're noticing is that there's absolutely no activity. And that is because chlorhexidine is a kill agent and it kills everything in its pathway, including the good stuff. We've all kind of known this, but we were looking and searching for ways to do things differently. And that's where we play a role. So now you get to see what happens when they did the skin test with StellaLife. And not only are the fibroblasts out, they're actually closing the wound. This is accelerated wound healing. This is what makes the wounds close in record time by giving the cells exactly what they like and not harming the good stuff. This study also went on to examine EO, which happens to stand for Listerine, and they noticed that over 80% of the fibroblastic activity was removed. It was killed. So it's definitely something we don't want to be using after any kind of traumatic injury to the tissue, even in a scaling and root planing or surgery. We want to stay away from these things that cause these kind of problems for wound healing. And the last study I'll show you tonight on wound healing came out of Indiana University. Premier school really got curious about fibroblasts as well. And they wanted to know, well, what happens when we expose it to chlorhexidine, iodine, our gel, and another product? So they examined and studied particularly what was happening to those fibroblasts, and they discovered exactly the same thing that the other university studies have shown, is that StellaLife was the only product tested that did not harm fibroblasts and remain bacterial static. So that got us really curious, and others really curious about, so this is all really interesting. We're healing wounds in rapid time. We're moving those fibroblasts. We're creating these incredible wound healing environments. But what exactly is happening to a few of these bacteria? So Rutgers decided to do a study and examine particularly FN and PG. So as you guys know, FN is a really bad guy. It's a bad pathogen. It's very inflammatory. It's actually a carrier of so many other bad pathogens. And it's absolutely not what you want around when you are doing implants or even in your perio patient that you're putting through scaling and root planing. We want to remove or at least minimize the FN component. So when they did this study, they discovered it was over a 12-hour kill rate with just simply our rinse. So this gives us good news that these kind of pathogens can be controlled during this process of healing and even long term. And the other thing was very interesting was PG was over 96 hours. So imagine you have these patients with beautiful restorative care, and they've put a lot of investment into it, and you have invested a lot into that patient. And we really want their restorative care, their hygiene care, their implant care to last as long as it possibly can. And these are some of the key factors that happen when they go home and they start to do their own home care and they start to recolonize. We want to control that. And that's what this study is really impressive, is that we're doing that for very long periods of time. On top of that, they were the ones that discovered that we were the least toxic to commensal, leaving the good bacteria alone, letting it do its important job that it does. And it disrupts biofilm. So you're disrupting the colonization, allowing the patient to have easier methods to remove it with water picking, water flossing, brushing. It's going to allow them to have a better level of overall care long term. And then we started to look at some of these very challenging cases. And I share this with you tonight because this is really a great long-term look at a pemphigus case. So Loma Linda University, one of their students at the time, Dr. Theril Alkodami, he was a student, came to one of the meetings and said, I've got this patient in our clinic Nothing works. We've tested blood. We've done all of these things, used steroids, all of these that we've thrown at her never seem to do much for her. And she's in a lot of pain and she is suffering. Is there anything else that we could try? So we said, absolutely, let's try. Let's see what happens. So we sent him home with our coconut rinse and our recovery kit. These patients tend to have very sensitive tissues. They're hypersensitive to any mint, any flavoring, really. But coconut works for them. Our coconut rinse has over 9 ingredients in it, and they're all scared towards being able to be very soothing to the tissue. And of course, all of the other qualities of the antimicrobial bacterial static component. So here she is 3 years later, looking like this. They continue to follow her. And as a side note, she ran out of product for a couple of weeks. And what they shared with us was that she actually started to have some symptoms. She was getting some inflammation and some identifying wounds were starting to occur. So we know in the patient like this, while they're very high risk, very hard to treat, this is a great outcome and a life-changing experience for them to be able to eat and brush the way they need to. So we share this with you because you may never see this in your office ever, but if you do, you always want to know this could be in your toolbox and possibly and potentially a way for them to help with their healing. And Stony Brook University in Long Island was also very interested because we have all been teaching so much about being able to manage the gingivitis patient. So what we asked them to do is to take a look at a experimental gingivitis and compare the results to chlorhexidine. And what they found in this study was it was absolutely great news. It acts just like chlorhexidine in terms of controlling the gingivitis and the bacteria that's causing it, but it doesn't have those harmful side effects. And the staining, which nobody likes, including our hygienist, if any hygienists are on this call, it's tenacious and it's difficult. And we were always looking for an alternative, but this is what's got us an opportunity to be able to treat patients in a different way than we have in the past. And that is a long-term use product as well. So I mentioned again earlier that we really had an important mission in mind is to reduce the use of pain medications like opioids. Opioids are still a big problem in the US, and everything we can do in dentistry to help reduce the need to dispense them is great. So what we wanted to do is take a look at, again, a little bit longer term study on dispensing. And this oral surgeon, Dr. Walter Tatch, was measuring every year how many opioids was he really dispensing. And what he discovered was the numbers kept going down, down, down. And this was really good news. And it has so much to do with preemptive analgesia. That's what happens when you use our recovery kit in surgeries 3 days prior. And what you're allowing the patient to have is an opportunity to have less inflammation. And we know that inflammation equals pain. So it's allowing them to use an acetaminophen Motrin combo and being able to suffice for any discomfort by using the kit and that combination that they have right in their home and doesn't even cause any addiction issues for them. And real early on in our journey, we also had a really neat study on bone blocks by none other than Dr. Cameron Lee, an oral surgeon in Hawaii, and Dr. John Suzuki, world-renowned Dr. John Suzuki. And they discovered the same thing that we'd been seeing all along, is that the groups that received StellaLife prior to and post-operatively had less pain scores, healed faster, and overall really had a better experience. And that's really what it's about, is managing them in ways, as I mentioned earlier, that maybe we haven't been able to in the past. So here's the kit that they used and in these studies, and you'll see it's a 3-part system. The rinse is used first, and it's 3/4 of a tablespoon. Doesn't take much. You swish for about a minute, and then they spray under the tongue sublingually with our spray. Our spray is allowing your patients to get a little bit systemically into their bloodstream of not only the antimicrobial and anti-inflammatories, but it also has some calming effects on the body in the ingredients that we chose. And the gel is topical. It's placed directly on the wound, or if you're placing it prior to, it's going to be applied right where you're going to be doing the surgery. If you're extracting all the teeth and making immediates, you'd place the gel everywhere. So it's a really easy system for them to follow. And all the instructions are on the side of the box, visual as well as all of the ingredients are on the back of the boxes to tell them exactly what plant is that and what is it doing. And everything that we do at StellaLife is very well researched, and we use some of the most unique manufacturing facilities to make this, as well as very high quality GMP approved facilities. These are good manufacturing practices. That means that manufacturer is observed and regulated by the FDA, as well as the laboratories that test our product. This is crucial for us to make sure that every time you get one of our products, you're getting the same efficacy over and over again. It's valuable information too for you to know plants and minerals are different and often have a different effect. So we want to measure that and make sure that's always great. I think I saw a hand come up, Rachel. I don't know if you are on the call. I think maybe we had a question. I'm happy to stop for a moment if we'd like to answer any questions.
It does look like a hand went up and then it quickly went down.
Okay. Okay, so please, you can put your questions in the chat, and at the end, we'll definitely have time for Q&A because I know you're going to all have some questions that we'll hopefully be able to answer for you. So our rinses are really designed for so many things, and there's so much value to them. But as I mentioned when we talked a lot about how they're made, we really pay a lot of attention to focusing on and the antimicrobial bacterial static of these rinses. We want them to be able to work for long periods of time. They taste good, which is half the battle with our patients. And when I worked in dentistry for years, I know that they won't use it if they don't like it. So we had to design things that they actually would enjoy using, feel the effects of it, and be able to really see the results of it as well. So we're really focused on particular pathogens, and we're learning more with every study, every time that we bring the product out, even in salivary diagnostic testing, we're seeing those pathogens and what exactly they are and how they are decreasing over a period of time. So these rinses are really critical in the picture for the patient for short-term use as well as long-term use. And also, I always like to mention, so many of your patients come to you and they have canker sores and they have cold sores and they're really never sure, what can I do about this? Well, Dr. Scott Fromm, who is also one of the world-renowned periodontists who's doing some really unique things in his practice, he is a wonderful person to connect to. He has peri-implant advisors and writes articles and does a lot of case studies that are so informative about how we need to be looking at the whole body connection. And what he wanted to know is, if I put patients on laser treatment and I put patients on magic mouth rinse, and then I had a group that got the StellaLife gel, what would happen? And what he discovered was that it took about 10 to 14 days for the patients to completely wound heal with the laser and magic mouth rinse. But with StellaLife Gel, it only took 2 to 3 days. So the question is why? How does that happen? It goes back to the very beginning. It's an antimicrobial, cleaning the wound site up. It's an anti-inflammatory, decreasing the inflammation around the wound. And even more importantly, it's not harming those fibroblasts, and it's moving them very quickly to close the wound. So I always tell my doctors who love their laser, please zap your wound, but then use StellaLife Gel after and send them home with that. We should see even more rapid wound healing. So I always mention this because I want you to know that's in your toolbox with these products. And cold sores are the same way. We can really do so many things with these products that allow the patient to have a resource at home as well. And then Today, there is a lot of talk about nitric oxide. You're going to learn a lot more about that over the next several years. There is a very crucial element that we need to pay attention to in our patients, particularly the ones that have high blood pressure or have heart disease and have high inflammatory markers. Nitric oxide is stored in the salivary glands. It's made when you eat food and you have commensal bacteria and they come together. And what we know about nitric oxide is that it plays two really crucial roles. One, it boosts our immunity, helps our own bodies fight disease better, like viruses and bacteria. But even more importantly, it plays a role in keeping your arteries soft. It helps to keep those blood pressure patients and their arteries more supple so blood can flow through them easier. What we've learned is that there are many oral care products that we have prescribed to our patients over the years that kill everything, including nitric oxide. So, of course, we had to know. And Dr. Fromm graciously did a pilot study. He wanted to know as well. And the good news is that we were stealthy again. It does not harm nitric oxide. So if you're thinking of these types of patients, this is the kind of thought we want to put to them, is that we don't want to use products that harm fibroblasts. We don't want to use products that kill commensal, and we don't want to use products that actually harm nitric oxide. So as we evolve, I think we're going to learn a lot more about nitric oxide and the role dentistry is playing in it. But the good news is StellaLife does not bother it. And that's a good news for our patients. So I would like to share with you right now a little bit more of the surgery side. This is Dr. Picos from the Picos Institute, and he wanted to share his experience in what we call, again, the 333 program, and share with you a couple of his cases and what they look like very quickly after surgery.
There's your 333 regimen we talked about. It's very impressive. Here's a typical V-plasty with Eloderm. Time 0, there's 5 minutes. Hemostasis is like, boom, amazing. But keep gauze on it for a good 4 minutes by the clock. That's the key to low compression, and let it soak in, and bingo. Here's a case of just cytoplast over extraction sites. Again, tissue is beautiful, responds very, very nice. And then here's our typical, 48 hours later, that's what things look like. Very typical. It's amazing.
So every time I look at this picture, it reminds me of the days when we used to do so many more immediate dentures. And we still do that today because some patients aren't quite ready for implants and we have to extract teeth. And I can remember how severely swollen they were within 24, 48 hours when we had to remove the immediate denture. And what we're learning is that with StellaLife, if we start 3 days before and we're using immediates, you can put the gel inside of the immediate denture and place it right up against the sites. If you continue to use the product 3 times a day, all 3 products, the patient will see a very different picture in 24 to 48 hours, and you will too. It's much less pain. There's a dramatic less inflammation, and it's so much cleaner in the oral cavity for the wound healing perspective. So here's just a few cases for you to see that have been shared with us by some of the doctors that have been using the products. A bilateral sinus lift showing you that this is the StellaLife side, and the opposite side is the traditional model of care at 40 minutes. You can really see the difference in the hemostasis quality this product has, as well as the healing that's already occurring. And of course, after an all-on-6, back in the day when I used to do these things, I didn't personally do it, my doctor did, but when we did these, the inflammation was tremendous. You couldn't even see the implant. So this is at 40 minutes. The patient's looking really good, and they will continue to use the product for 7 to 10 days. After it, and I always suggest use it until it's gone. It's such a good thing for them to be doing. And they can use our rinse as a maintenance product. And an impacted canine extraction bone product was placed here as well. And here they are, 7 days post-op. And when I show this to my hygienists, they're pretty impressed with the ability to keep everything so clean. And that's what's wonderful about products like this. And the innovation behind it is that we're doing so many things at one time for these oral microbiome and keeping it in the healthiest state it can while they're going through the healing process. So I'd like to share with you also how you can apply the gel right after surgery. And this is Dr. Walter Tatch, an oral surgeon, demonstrating to you how you could do the same.
Walter Tatch here. This is a case of all-in-6 reconstruction with immediate temporization. We're going to apply right after the surgery StellaLife Vega oral gel over the surgical side with the suture line and then the vestibule. We'll bring the patient back 15 minutes later for delivery of the temporary prosthesis, where we're looking at the soft tissue. A week later, you can see the tissue is already responding very, very nicely.
So adding that extra layer of gel at the end can really help soothe the tissue. It'll give it another layer of antimicrobial and anti-inflammatories and allow your patient to have that advantage. So just again, to remind you, it's called the 333 program, so we wouldn't forget. And it's all 3 products 3 times a day, 3 days prior, and continuing that same protocol post-operatively. Now I'd also like to share with you what we've been doing in the non-surgical arena with our hygienist and scaling and root planing patients. So when we use our cavitrons, piezo technology, or even lasers, with using this product, what we recommend is that the patients either have recovery kits, or in some cases, we can use rinse and gel combinations. It's really the risk factors that can determine this. And also, if you are salivary diagnostically testing and you have really high levels of pathogens, think about bringing in the big guns, which is our recovery kit. So your hygienist will scale and root plane with sterile water through their apparatus or their laser. They'll use their laser. And then afterwards, they just simply take a 3M syringe, fill it with some rinse, and flush and irrigate the sulcus. The reason you're doing that is there's debris that gets caught down into the sulcus after treatment. So we want to get rid of all of that. And we also are layering this nice layer of an antimicrobial. And then with a hand mirror, if they hold it up and show the patient, they can apply the gel interproximally where the non-keratinized tissue is and on the margins. You can choose to do that site specific or everywhere if it's required. A patient goes home with either the recovery kit or the rinse and gel, and they continue 3 times a day the protocol while they're in active treatment. Once they're completed with active treatment and they're in what we call a remission state, then you can have them use the rinse on a daily basis, morning and night, as a maintenance product. The other thing that's really great about this is that it moisturizes. So dry mouth patients really have an ability to not only be moisturized with this, but they're also killing strep mutans and other pathogens that can really cause some destruction for them as well. So we use it often with dry mouth, and they really like the way it feels. It's not real thick, and it feels very soothing on the tissues. So it's a wonderful opportunity for them to have something that's doing, again, all of those things that I mentioned. And then when it comes to halitosis, this is also a really, really a big deal. We see this a lot. Patients ask, I have bad breath. What am I doing wrong? Why is it there? These QR codes are for you as well. Feel free, if you take your camera on your phone and click on it, it can take you right to the studies and the research behind these products and these topics. So with halitosis, we understand much better today than we ever really realized about some of the root cause. I'm going to show you something here in just a moment that we developed that we feel very strongly will support these patients with halitosis in maybe a way they haven't had before. But the products, because of their kill rates and their long-term kill rates, can really help a patient almost immediately feel the difference and be able to have less odor coming out of the oral cavity, because we know there's gases that are given off by these pathogens, and we're controlling that. Even in dry sockets, we see by using our gel in dry sockets, it can really soothe that site, accelerate the fibroblastic activity, clean everything up, and rapidly wound heal them. And of course, the goal is to always have no dry sockets. So trying to accomplish that, even with smokers, can be a challenge, but using the recovery kit prior to has anecdotally really proven to us that it's a very important piece of the puzzle to help avoid that. Even in ortho, if you're using Invisalign trays or brackets and bands, these products work so well for these patients. Think about it, how you have a retainer in place for hours and hours each day, and it's full of pathogens. So you can actually put the gel inside of the tray, place it up against the tissue, and it will keep the tissues much healthier, at the same time relieving any discomfort of the tooth movement from the Invisalign or an aligner tray system. So lots of different ways to use the products, lots of different applications. And the best part about this is what, in a lot of ways, what we've been doing for mucocutaneous diseases. I showed you what we accomplished with pemphigus. This is lichen planus in 1 week without steroid use. This is our rinse and gel combination that the doctor chose to use. And at the time, we didn't have probiotics. So we today would probably go back and introduce probiotics along with the rinse and gel. And I'll tell you why that would be the case in something like this. But we know this is an autoimmune condition. This is not curable yet. So we need to manage the oral microbiome differently for these patients. And these patients now will be on our rinse for twice a day. If they start to get a flare up, then they can go right away to using the gel at the site, and which will control the inflammation. It'll clean up the site and help it rapidly heal so we don't get ulcerations. And mucositis. Near and dear to our hearts are cancer patients. And chemotherapy and radiation, as you all know, is really savage on the oral cavity. We see lesions, we see burning mouth, we see mucositis, we see external lesions on the lips. It's just angular cheilitis can form. There's so many problems that these folks have when it comes to their chemotherapy and radiation cycles. So what we're learning is that these patients can actually benefit tremendously from these products to moisturize, to control that environment and heal it. We have so much good data on this, and we have a wonderful protocol. And please feel free to reach out to us at the end of the program. I'll have an email address for you all. One of our wonderful friends, Dr. Mike Milligan, had stage 4 nasal pharyngeal cancer, a dentist for years. And he was going through a very, very rough time in treatment. And he wrote a whole protocol to help oncology patients and well as the oncologists, because they really don't know what to do with this. And so we have that, and we're so happy to share that with you all. It is a wonderful opportunity to take a patient through different things that worked for him and his recommendations as a dentist. So let's talk about what's new, and I'm really excited about this for you all. So thinking back about all the years of all the patients you've treated, and if there are any hygienists on this call and our doctors who are on the call tonight, one of the most frustrating things is when you have a patient who does everything right and still has pathogen levels that are causing active disease. It's frustrating for you. It's frustrating for the patient. What we've learned over the last several years as we've studied very in depth what's happening is that there is a true imbalance. We have way too many bad bacteria and not enough good. Probiotics are switching that game. They're creating more good bacteria that can overcome the bad. And I talk about it like a Pac-Man because that's really what it's like. They come in and they take out these bad guys and they become the star of the show. They're good bacteria that we all need. So what StellaLife did is something very unique. We created an oral and a gut probiotic. So you're working on the gut and the oral cavity simultaneously because we understand better that these pathogens can be from their origins can come from the gut. So what we did different is that we first of all used a spore for the gut, and that means it lasts longer in the stomach acids. We also did a prebiotic, which is food that keeps the probiotics alive. And we did a postbiotic, which is nutrients that are given off to be able to keep them alive longer. So very unique in what we were doing with this product over time to help rebuild the good flora. And on top of that, we added a couple of extra things. We added vitamin C, D, and zinc. So these patients are allowing to get the benefits of some of the C, which is very anti-inflammatory. C plays a really big role in helping reduce inflammation. The D, really interestingly enough, is one of the most important things we could be looking at in dentistry right now. It is really an important vital tool to boost your immune system, but more importantly, I'm going to share with you where we resourced it, as well as why it's important in implants here in just a moment. But we've added that, including zinc. So this is really unique in the formulation, as well as what we've been trying to accomplish with this. So here's your strains, over 17 of them, all very unique in what they do. And I'll pull your attention to a couple of them. One of them in particular inhibits the in immune activation of the periopathogens. We also can see a reduction in strep mutans. It's taking them out before they can cause a problem. It has antifungal capabilities. So remember those oral lesion type patients, they have a lot of funguses too. So we can use these probiotics to help reduce the funguses. And probably most importantly is Rhamnose. This is such a good bacteria and strong one that it actually can infiltrate the biofilm and disrupt it. Again, another good way for our patients to manage the disease that's present. And there's so much more of that's good about these. And at the end of the presentation, I'll have all the resourcing for you too. And it will be on our website as well. Where's the research behind these? We have all of that to share with you. But probiotics are becoming a really important tool. And anyone on an antibiotic should absolutely be on a probiotic. Antibiotics wipe out all the good flora as well as the bad. And with superbugs on the rise and so many challenges, we're trying to reduce the need for antibiotics. So if you do put a patient on an antibiotic, get them on our probiotics so we can rebuild the good flora as quickly as possible. And every patient who's going through scaling and root planing has a big imbalance. So these are the type of patients that can really benefit from an oral and gut probiotic protocol. And the best results come from usually at minimum 2 months use, because remember, it takes a while to get where our bodies are. So 2 months is a really good rule of thumb to be able to really get a good handle on rebuilding that good flora. And I'll share with you a pilot study. This was from Dental Advisor and Dr. Bunick, who is a periodontist up in Michigan. And he had a patient, he said, let's take a look and see what these things can do. So she's 29 years old. She unfortunately has a failing implant. Number 14 was failing. You can see she has a pretty severe case of gingivitis. She had 90% bleeding. She had plaque indexes that were 50%, and she had pocket depths that were around, on average, 4 millimeters. So what they did was they scaled and root planed her, and then they introduced the oral and gut probiotics. We told them, don't use our rinse, don't do anything else, but let's see what happens. And here she is, 6 weeks out, and more importantly, 4 months later. This is what she looks like. We are rebuilding the good oral microbiome. We're redesigning them to be able to have better flora, which gives them better opportunity to manage it. And so this case study went from being a pocket depth of 4 to down to less than, I think it was around 2. And then the reduction of plaque was amazing, 4% plaque indexes and 7% bleeding. And they documented the charting on this, so you can really see dramatically how much this patient changed over the course of that 4 months. So this is why we're very excited about, there's more research coming on this probiotics and how it works in different types of scenarios. We're looking forward to that being published, and it's very soon that we'll share that all with you and dive into even more studies to understand how powerful probiotics could be for our dental patients. So it's easy to take. You swallow a capsule, and a vegetarian capsule, so it's easy to digest, and then you suck on a lozenge, and you suck on it until it is totally gone, which takes around 3 to 4 minutes. It tastes really good. And when you talk about halitosis, this is the combination that they need as well. And the lozenge works immediately to help control the gases in the flora to minimize the odors that come out. And we just don't want them to use any of the rinse for about 2 hours after, just to be sure that it really gets an opportunity to really go to town and do its job. And lastly, tonight, I'm going to show you something else that's on the really forefront for all of you that are doing implants and bone grafting procedures and all of these integration procedures that we're looking to achieve. So Dentamedica was developed out of a really big need in dentistry. These particular studies as well are on our website, but in a nutshell, what they were looking at, and particularly the pause study, is very interesting because they took a group of patients, and I believe there was over 300 of them, that had failing implants. They were failing to integrate. The bone was not growing. And what they wanted to know is why? What was happening? Was it position? Was it biology? What was it? So they drew blood, they did all these things. And in the end, what they discovered was what was common amongst all of them was very low vitamin D, and not just a little bit. It was dramatic. It was from where you should be at 50. Excuse me for a minute. The pollen's been really high, so it gets my throat sometimes. The measurements were very low. These patients had 0 to 10. On average, and maybe 30. And so what we're advocating today is that we really need to check their vitamin D level prior to implants to give us the best chance at being able to integrate it. So this is what we did. We created Dentamedica. And Dentamedica is an incredible formulation made in a GMP-approved facility, and it has everything you need to help your patient have the best opportunity to get the bone to grow. As I mentioned earlier, D plays a critical role in pulling the calcium out of the bloodstream to an injury or a wound. If you don't have D, that's not going to happen. And then on top of that, you have to have K2 and E for that D to work. So if you go to the store and just buy vitamin D, but you don't have enough K2 and E, you're really not utilizing much of the vitamin D, is not absorbing. So not only did we add all of this nutrition, B vitamins, all of the minerals that you need, as well as things like copper and selenium and magnesium and zinc, we resourced them in a way that was extraordinary. I never knew this until we got involved with building this product, was that most of us don't even know this, but your resource for D3 usually comes from sheepskin. I was shocked. I had no idea. So what we decided to do is use lichen, which is a type of algae that actually is more absorbable. So your body will be more, and it will be more conducive for you to absorb that vitamin D by using that. So very special. The other thing we did very uniquely was K2 comes from chickpeas. So our vegans and patients that you might have that really don't want anything animal can use this product safely and within the realm of what they're looking for. And on top of that, we included coenzyme Q10. And coenzyme Q10 is an enzyme that you must have in your body. We're also pretty deficient in that as well. And it helps to move all of this throughout your body. It helps your body to move these minerals and these nutritional support systems. So we put it all together for you so that you have an opportunity to start your patients 4 weeks before to build the D up, and then 2 weeks post. If you can't start right away at 4 weeks out, you got 2 weeks. Get them on it and keep them on it a total of 6 weeks. It is a loading dose and it builds it up into their system. When they're done, if you want to continue using the product, you absolutely should, because it's such a good multivitamin for all of us to use on a daily basis. But you cut the dose in half because this is a loading dose. We want to get it up fast and furious. So loading dose, and then after, for long-term use, you can use it 2 tablets a day, 1 in the morning and 1 at nighttime. And when you really compare it to what's out there, and so many of these things today are not made in a GMP facility, so you really don't ever know what you're really getting and what those measurements are. And so we took a lot of effort to make sure that everything we do at StellaLife, we're trying to do the best job we can to give you the cleanest products and the best type of research to these products that we can. So it's incredible. And a side story is that we have a lot of people taking this now long term and have experienced the benefits of it, with being able to boost their immune system because of the D, and also being able to feel that they have a little less inflammation. So lots of good anecdotal data coming in from our doctors. So again, no other supplements while you're taking this, because again, it's loading dose and starting 4 weeks before and 2 weeks after. If you have a complex patient like a diabetic, really hard to heal, you may want to start them up to 8 weeks earlier just to really get that D level up. And you can test them for that in many ways. You can ask them, when was their last vitamin D test that your medical doctor provided? Ask them, if you haven't had a D test, then let's get you one ordered. You could also, there are chairside testing kits that are incredibly easy. You actually take, like a diabetic, you'd prick the finger, put it on a little slip and send it inside of the machine. And within 15 minutes, you're going to know exactly what their vitamin D level is. It's a great way to quickly find out and know where your patient is at. And because we're not in the sunshine as much, and we're not as, we're sunscreen, you just don't get D in our foods the way we used to. So this has been a really important and critical piece of the puzzle for our surgical patients. And we also do something extra for you all. One of the things we talked about early on in our journey was that we wanted to be more than just a product that was really good, but we wanted to be more to you. We wanted to help you grow your practices. So what we partnered with is a company called Schedule Widget, and I believe they're called Intelli now. And you get this for free. We have you gather just a little bit of information. It's your address and your phone number and who you are, your practice. And we add you to our search engine. When patients call or someone calls us looking for StellaLife, we send them here. They put their zip code in, and if you're in that list, they know that you have product available, and our goal is to drive new patients to you. So it's an added value of working with us, and we're striving to do so much more through education and expanding our educational model for all of your offices to bring more value to you. So I know tonight that was a lot of information, and I know that we covered a lot of different topics. We are so glad that you joined us. Your practices will always get 30% off of the retail when you buy a products in bulk, which is simple. One case equals bulk, which is 12 bottles of rinse or 12 gels or 12 recovery kits. And you get free shipping with it as well. Lots of marketing materials that are complimentary for your websites, as well as brochures. We donate those to you free. We feel it's very important for your patients to understand what you're providing for them, and for your team too as well. Great education for the team. We really want to work with them to help them understand why you're using this product and how the benefits of the product would be. And if you'll notice on my screen, this is our support team. If you make a note of this email address, if you will email us and put it to in the subject line webinar, then what we will do for you is we will send you a complimentary product, and we'll also make sure that we allow you to have all of the information that you might need that we didn't cover tonight, and learning and training with our teams around the country. We're happy to provide that for you, and continue our journey into creating an innovation and continuing to expand our product line to bring better and better things to you. So I think we have some questions. Rachel, do you want to open up the questions and in our chat, and I'll be happy to help any way I can.
Sure, Debbie. It doesn't look like we have anything in the chat right now, but I did just drop in some really useful links to our research and clinical studies. Also a link to all of the products that Debbie covered this evening, and then also Debbie's email. So if you have any questions, you can certainly reach out to her, as well as our support email that Debbie just pointed out. And then again, just mention that you were on this webinar and we'll reach out to you to set up some complimentary product your way.
Absolutely. Thank you, Rachel, for doing all of that. And I want to really personally thank you all for joining me. I know your day is long and busy, but we're so happy you are here. We plan on doing these training sessions once a month. We'll do them sometimes during the lunch hour, and we'll do sometimes in the evening for your convenience. We'll register and let you know when those are happening. So if you have friends, colleagues who'd like to learn more, anybody that might have a need to look into our products, we'd be happy to share that. And this was a recorded version, so we also will have that available. And Rachel, is there anything else?
Yes, there is one question that came in the chat right now. What is the pH of the mouth rinse and is it safe for long-term use?
Sure, great question. So when you look at our mouth rinses, what we've really tried to work hard is to get the pH closer to where you all want. So on average, our pH can be around 5 to 6 with our coconut rinses and our spearmint rinses. And so we're working and constantly trying to achieve a higher level and getting it closer to 7. So much of that long-term use we've seen now for over 7 years. We do not see side effects of long-term use like erosion or complications of any kind. So we're very excited that patients now have an opportunity to be able to have something that does so much for them. And we will always continue to strive to achieve the highest pH levels we can for you all to be very happy with the product. Any other questions?
It doesn't look like that. Looks like we're good.
All right. Well, again, thank you all so very, very much. We look forward to working with you. If you're on the call that you're using StellaLife, again, thank you so much. We'd love to hear your stories. Please share them with us, cases, before and afters. We'd love to feature you and share you with others in the dental community. Rachel, thank you so much for joining me tonight. Thank you all for taking the time to be with us, and we look forward to hearing from you all. Thanks again, everybody.